Good afternoon, everyone, and welcome to the July Virginia Governor's Conference on Aging webinar. It's been a couple months since we've seen everyone, but we are excited to have you all back. We're going to give everybody a minute just to get in the room and get situated, and we will be right with you and have some exciting announcements. All right, for the sake of everybody's time, let's go ahead and get started. Welcome again to the July webinar of the Virginia Governor's Conference on Aging webinar series, held every fourth Tuesday of the month, although we've skipped one or two the past couple of months. Things have been a little busy, but we're excited to be back. This wonderful webinar series is sponsored by Virginia Housing, and we couldn't do this without them, so thank you very much. But also thank you to our partners, the Virginia Department for Aging and Rehabilitative Services and the Virginia Association of Area Agencies on Aging for making this webinar series possible as well. Our exciting announcement for those who have seen our e-blasts that have gone out the past couple of days, we have set our dates for the 2023 Governor's Conference on Aging. May 9th and 10th will be at the Richmond Marriott downtown, so please mark your calendars. We have some really exciting announcements that are going to come out over the next several weeks, so stay tuned, watch your email, as well as if you saw the email that went out yesterday, we have a special one-day session, pre-conference session, the Virginia Dementia Capable Summit. And if you are interested in getting more information about that summit as it's released, we have a email mailing list that information will be distributed on. So please put your email address in the chat box and we'll add you to that email distribution list. Just throw your email address. I will put it with your name in that email distribution list for the Virginia Dementia Capable Summit. On May 8th, it's a special pre-session to the Virginia Governor's Conference on Aging presented by the Alzheimer's Disease and Related Disorders Commission, DARS, and the Virginia Department of Health. And it will have a particular focus on advancing brain health and dementia risk reduction, and will be a great opportunity to learn about the dementia state plan and provide input on the next version of the plan. So that team is really hoping you'll join them on Monday, May 8th, leading up to our two-day Virginia Governor's Conference on Aging. If you are also interested in being part of our planning/steering committee for the Governor's Conference on Aging, you can let me know in the chat box as well, and I will follow up with you. But not to take up too much presenter time, let's go ahead and get started. Our webinar today is to highlight our 2022 Best Practice Awards. Advancing innovation in aging programs. So we are going to celebrate all of our award winners and hear from each of them today. But real quick, before we go ahead and get started, there are a couple of things that we want to highlight for you all. Throughout the presentation, I encourage you to submit your questions in that Q&A box at the bottom. And in that Q&A box is where we really are going to take those questions from. You can use that chat box, like I said, if you want to share some comments, but the Q&A box helps us pull those questions at the end when we move to the Q&A section. If you want to ask your question live and request to be unmuted rather than type your question in, you can use the raise the hand icon right there at the bottom. And we will call on you and allow you to unmute your computer, and you can even turn your camera on. You'll have the ability to turn your camera on if you need to and ask your question that way rather than typing it in. Also, and this was left off, but if you do have the ability to turn on the closed captioning at the bottom as well. You'll see a CC option at the bottom of your screen as well. And I believe Charlotte will touch on that a little bit more. And if you have any other questions, feel free to type those in the chat box. You can reach out to me or any of our other staff throughout the presentation. But with that, I'm going to turn it over to Charlotte and she will move on with our presentation. So thank you so much for being with us today. Charlotte, you are muted.
Okay, thank you, Martina. Is my screen looking okay for you all?
Looks great.
Okay, I'm going to turn it over to the Commissioner of the Department for Aging and Rehabilitative Services, Commissioner Kathy Hayfield.
Good afternoon, everyone. It is my great pleasure to welcome you to today's 2022 Best Practices Awards webinar. I believe this is our third time having this webinar in a virtual manner. This year, we were also able to have live celebrations for each of the award winners. So this is great. We have the best of both worlds. And those of you who are here have a real treat ahead to hear about these three amazing winners of the 2022 Best Practices Awards. In Virginia, we're really so fortunate to have this shared partnership between Department for Aging and Rehabilitative Services, the Virginia Association of Area Agencies on Aging, the Commonwealth Council on Aging, and Dominion Energy. The Commonwealth Council on Aging sees this as one of their greatest opportunities to share the great work that's going on all across the Commonwealth. I want to thank the DARS communication team and V4A for helping make this webinar possible and for linking up with the Governor's Conference on Aging. It's a great platform for us, so we're very appreciative. We would like to hold this webinar today in honor of a true champion and advocate for aging services in the Commonwealth. Many of you know that Jane Woods, Senator Woods, Secretary Woods, died this past week. She was known for her brilliant work on behalf of older adults and the aging population. She was an amazing advocate and champion to improve the lives of people in Virginia so that their independence in their homes could last as long as possible. We also know Jane for her amazing heart, her kind heart. There's a great void in the Commonwealth losing our dear friend Jane Woods. And today I want us to honor her as we look at the best practices across the Commonwealth and as we think of the great work she did to improve the lives of the older Virginians. So at this point, I'm going to pass the torch to Jennifer DeSano, who is the chair of our Best Practices Committee, and she'll lead us on. Take it away, Jennifer.
Commissioner Hayfield, I apologize. We did have a last minute substitution and instead we have Diana Pagawa. And I'm sorry, Diana, I think I said your last name wrong, but she is a member of the Best Practices Committee.
And I know, Diana, you'll do a great job.
Thank you so much. Thank you. The Best Practices Award was started by the Commonwealth Council on Aging in 2006. Dominion Energy has been supporting the awards since 2012, and we are grateful for their support. The Best Practices Award have a storied history of recognizing innovative programs serving Virginia's older adults. In reflecting on this year's award, I am reminded of how relevant they all were to the unique times we are living. The Council on Aging Best Practices Awards Committee received over 20 applications this year. It was a very competitive process to review the applicants and decide on the winners. The year's winners truly reflect the relevant needs of older Virginians in 2022. Program winners and honorable mentions focus on addressing social isolation and social connectedness, transportation, person-centered care, access to healthy produce, and aging advocacy. Today's webinar will feature presentations from the first, second, third place winners. This will be followed by time for questions and Q&A. Feel free to post your questions in the Q&A box on the chat box. We will come back to them later in the webinar. Now, without further delay, let's get into the presentation. At first, we have Emily Bradley. Emily Bradley is the program manager for NV Rides, a community-based partnership of volunteers driving program. Emily Bradley, is an RN and has been the manager of NV Rides since November 2021. I'm sorry. Go ahead, Emily. First place, NV Rides, Emily Bradley. Take it away, honey.
Hello, I'm Emily. I'm the manager of NV Rides, and I'm so honored that we won first place this year, and I'm so honored to be speaking with you all. You can go ahead and advance the slide. So we are community-based volunteer driving programs in Northern Virginia, and we support seniors aging in place with transportation, and we promote awareness of volunteer rides programs. You can go ahead. So we serve the 4 counties of Northern Virginia, which are Loudoun, Fairfax, Prince William, Arlington, plus the city of Alexandria and city of Fairfax, city of Manassas, Manassas Park. Criteria vary by where you live and what type of rides are offered, but the entire region does have volunteer transportation programs, and almost all of them are affiliated under our umbrella of NV Rides. Go ahead, one slide. So here's what we do. We're the umbrella organization. We don't directly provide rides, but we do a lot of other things. We support and fund a ride scheduler and tech support training. We support volunteer driver background checks, and we fund them and administer the system. We do a lot around marketing, recruiting volunteers, engaging volunteers, and PR. We assist our partners with program development, be it grant writing, looking for sources of funding, problem solving, best practices. We refer lots of riders, and we also refer volunteers when we recruit them at events. So we wear a lot of hats. Go ahead a slide. So here you can see our partners. They're really diverse. There's religious organizations, government organizations, shepherd centers. So here's some high-level criteria. All of our riders have to be ambulatory. Like I said, we don't directly provide the rides, but we refer riders to a partner that does. We are not means tested. We don't verify disability status. You do mostly have to be over 55. The rides are no cost, but some of our organizations have membership fees, so it's not a per ride. So our drivers are all volunteers, and they all use our cloud-based system, Ride Scheduler, to determine which rides they want to pick up. Ride requests are entered, drivers receive the email, and they can choose which rides to accept based on their availability and geography. Drivers are using their own car, and they have their own insurance, and then the organizations also have an umbrella policy. The drivers track their mileage and hours in our software, and it's been really popular now to track it because most of our organizations are nonprofits. So the hours are considered like a donation, or the gas money is a donation. So it's tax deductible. Go ahead a slide. So our average rider here, of course, very diverse, but our average riders, and most of our riders are female head of household. lots of widows and widowers. They're usually a little bit above the poverty threshold where they couldn't get, government assistance or free programs, but they're fixed income and wouldn't be able to afford like a consistent Uber, Lyft, or taxi. And then we also provide connection, community, socialization, camaraderie, lots of other things beyond just getting where you need to go. So people are looking for that social interaction as well. Our average driver is 68, lots of recent retirees. A lot of people are familiar with the volunteer program because maybe a loved one used one, maybe out of state, another region. A lot of people are concerned about aging in place. And then a lot of people want to make sure these programs are strong when they themselves might need them. So they're trying to ensure the sustainability of the program and they want to volunteer. So ride trends, we do about 5,000 rides a quarter. That's been pretty consistent. Big increases in grocery shopping and food pantry with the pandemic. More medical appointments were virtual. We're seeing that change a little bit, but that was the end of 2021. We did 20,377 rides in 2021. So we're really proud of our scope and our reach. And I think we're going to beat that in 2022, even with gas prices. So you can see this includes some of the pandemic and some pre-pandemic. You can see most of our rides are medical therapy. Blank is actually most likely medical. A little bit of grocery shopping in there. And then we do some other ride types like friendly calls, friendly visits, job interviews, dental, mall, different. We're not strictly medical, but you can see mostly medical appointments. So a big part of our program is social connection and community and reducing social isolation. There's a lot of rapport and relationships that grow when people have a consistent driver or even a driver from a consistent organization. So we know that we're creating friendships and connection beyond just getting people where they need to go. So I think that's a big benefit that's been noticeable during the pandemic. Go ahead a slide. So just so you know how we're funded and our partnership, we're a partnership between the Pozos Jewish Community Center of Northern Virginia, where I work and where we're housed, the Jewish Council for Aging of Greater Washington, and Fairfax County, and we're funded by the FTA Enhanced Mobility Grant. We're always looking to expand, find new partners. I'm always looking at where our calls are coming from and whose needs what to try and strengthen our program and fill gaps. And we're always working to find out what our riders need. So, geographically, culturally, we're always looking to expand and meet our population's need. So if you have a partner organization that'd be interested in volunteer driving, I'd love to chat. I think we can expand further. Go ahead. So of course, our program is exciting. Maybe you want to start this in your community. So here's a few high-level tips, and feel free to email me. So consider a narrow focus at first, specific neighborhood or community, volunteers who know each other, maybe they know the riders. Keep it local, prove you can do it, and then you can expand. That's how most of our partners started. It was small, and then they grew to bigger regions. So a couple points you'll probably find. You need umbrella insurance for your organization. You need a system to verify license and insurance. We use Ride Scheduler. You can do Excel. There's lots of other programs, but you need a way to keep track of it and a way to fund and track your background checks. Early on, you'll find you need to bound your program a little bit. So make sure you have guidelines around medical rides, what you do and don't do, what you can and cannot offer, maybe your geography, origin points, destination points, because you'll get a lot of questions, and have a plan for those riskier rides like sedation, anesthesia, and hospital discharges. Those are the calls you'll get first, and you'll want to have an idea of what to do in those situations. You'll need a transportation coordinator, a volunteer paid, somebody with consistent hours, even if they're a volunteer, and you want to protect your volunteers. All the requests and all the communication should go through the transportation coordinator, so the volunteer doesn't feel like they're like an on-call service. Allow volunteers easy back and forth two-way communication with the transportation coordinator, and then the transportation coordinator will need some software to manage the requests. And so there's lots of resources. We use these resources. Shepherd Center is probably the model we're most affiliated with, which is the Project Turnkey. It's a completely free step-by-step guide on how to start a volunteer transportation program. The Community Transportation Association of America also has some great resources, and they're affiliated with 700 programs nationwide. So they're going to have a lot of best practices that we draw from too. So we have one model, we're free, we have partners, but there's other models that work. And so to think about your community, there's Neighbor Ride, which is in Maryland, Howard County. They use a model where you pay a nominal fee of maybe $5 per ride, just to fund the volunteer organization, and then the volunteer provides the ride. ITN America has a model wherein you trade in your personal vehicle and you get credits for volunteer transportation. So there's different ways to do it. We have our way, but there's other ways, and I'd love to see this grow. So I would love to have colleagues. I'd love to have more people to talk about this with. So if you're interested, please email me. We also made free training videos. They're on YouTube. They're great for training volunteers. You know, you'll need something to train your volunteers. And then our email address is at the bottom. That goes to me and my colleague, Julie. There's just two of us, so we'll definitely get back with you. I'd love to see this grow and share best practices and challenges. So thank you so much for listening to our presentation and awarding us this year. We were honored, and on behalf of our 16 partners in Northern Virginia, we thank you for thinking of us and allowing us this opportunity.
Next up we have Carlisle Shelley, who is the Assistant Director for the Virginia Tech Center for Gerontology. Joining her will be Tina King. This is the Executive Director for the New River Valley Agency on Aging. Together, they led the development and implementation of the COVID Companion Program. Take it away, ladies.
Thank you so much. It's such an honor to be recognized and to be here today for this webinar. And I'm also honored to be doing this presentation with Tina King, who is also a really pivotal partner in making COVID Companions happen during the pandemic. So what a pleasure to be here today. Next slide. So to tell you a little bit about what COVID Companions is, the program was started back in the fall of 2012 through a pretty large partnership through Blacksburg Police Department, the Virginia Tech Department of Population Health Sciences, the Center for Gerontology, and the New River Valley Agency on Aging. So it was all these forces coming together to make COVID Companions happen. And the goal of the program was to improve the quality of life for older adults living in the New River Valley who were becoming isolated due to COVID times and the need to stay socially distanced. And it was a way to bring connection back to older adults through the connections with community members. Next slide. So as many of you know, during COVID, older adults in particular became very vulnerable to being isolated from family, from friends, and they needed that companionship. And so through CARES funding, we were able to establish COVID Companions, which matched community members, many of them students, some of them faculty, and then other community members in the New River Valley with older adults, and they would meet via telephone or through Zoom. Many of them through the grant got iPads that they were able to connect with their matched community member, and they were able to meet, many of them weekly, to talk about life, to talk about concerns with COVID, just to bring back that connection and companionship that was so lacking during the pandemic. Next slide. And so the big overarching goal was to improve the quality of life of older adults, but to also provide outreach and educational resources. And then next to that was to increase the connection between community members and older adults. And by doing those two things, the goal of the program was to help reduce social isolation among rural dwelling older adults, potentially target food insecurity by connecting them with resources, and then reducing ageist views among community members with the New River Valley. we know that many people just don't have a lot of opportunities to understand, hear the stories of older adults. And so this program allowed them to connect with these community members and take the time to hear about who they were as people, to hear about what their concerns were related to the pandemic. And as a result, we hope to be able to target the prevalence of ageist views within our community. Next slide. And so I'm going to hand the baton over to Tina here to talk about the connections we made with older adults.
Thanks, Carlisle. Well, as an agency on aging, we were so excited when the New River Public Health Task Team and Virginia Tech and others in the community decided that this was a program that they really wanted to work toward, and allowed us also to partner and to bring it to fruition. The big view on this is in terms of how all this with the connections were made and the framework was set up. Of course, it was matching older adults with a New River Valley community member. And the volunteer was expected to make a commitment to the older adult to make contact at least once a week for 30 minutes. They could use a platform that was most convenient. Some already had some smartphones. Others, as we'll talk a little bit more about, and Carlisle's already mentioned, were given tablets to utilize, but many of them also just used the good old-fashioned telephone. Advance the slide, please. So it was a Fire HD tablet, and 17 of those have been given out. And I think there's about 40 total that are available. And the volunteers walked the older adults through the steps of how to utilize it. But as you can imagine, there were difficulties because of COVID. They were not able to meet in their homes and go over this in person. So trying to walk through it by telephone was a bit challenging, but there were some that it worked quite well and were able to utilize the tablets and or perhaps their own smartphone to make that face-to-face connection each week. Advance the slide, please. So once the program was created and older adults we were ready to start the recruitment efforts. That was done through Facebook and putting flyers at pharmacies and with physicians, certainly through our agency in the context that we had or have, and then also with other community-based organizations and programs that have contacts with older adults, along with just communal spaces that are frequented by adults. I have to say the group of students that you see here truly played the strongest roles in putting this program together. It was their creativity and their hard work and their perseverance that made it happen. Laura York and Emily Hoyt actually developed the mission and the vision and put together goals and even a training program. Then Callan Nissan, who was the volunteer coordinator, did the managing and the scheduling and carried out the training for the volunteers. As Carlisle said, we also wanted to utilize this program as a medium to get information out as well on COVID-related topics for the safety of those who are in the program. So that was done through the student Lauren Blackwell. The information was put together. And then Sam Miller was a communication specialist who helped develop the marketing plan. Would you advance the slide, please? So we currently have 31 pairings, 31 participants in the program. We actually have a good problem that we're going to need to start recruiting more older adults because we have 50 volunteers. And currently, as I mentioned, 17 of the active pairings are utilizing the tablet in their communications. So who is volunteering? Well, as you might guess, since this was a student-driven project, the bulk of the volunteers are in the age category of 18 to 24 years of age. And then the next largest category are 56 plus. Then with the affiliation that they have in the community, again, Virginia Tech students are the largest category, community members and recent graduates, and then other. individuals are involved. So with implementation, I think of the survey data, I'm going to hand that back over to Carlisle.
Wonderful. Thank you, Tina. And I would also be remiss in not mentioning Pamela Teaster's role, who's the director for the Center of Gerontology, who worked very closely with Tina King and the public health students to implement and oversee this program. As some of the students have left, I've become the new coordinator for COVID Companions, and am relatively new to the program, but I'm excited to see it forward. So to backtrack a little bit, so the survey that we gave to volunteers helped us understand the experience they had in being part of the program. 95% of the respondents rated it as a good or excellent experience. And 2/3 of them said that they spoke with their companion at least every other week. So that consistency is really positive feedback to hear. And this might be due to the population that we were able to recruit as volunteers being largely students, but half of our volunteers had never worked with older adults before being a volunteer for COVID Companions. So that's a neat connection that through these different generations are being able to come together. And through that, they were able to change some of these negative stereotypes that they might have had around older adults, which tracks back to one of our goals that I talked about in reducing ageist views. So being able to have different ages of volunteers connect with older adults was a really positive outcome of this program. Next slide, please. And so as we look forward, one of the key pieces that we need to keep this program going is to find sustainable funding for this program. I'm taking this on right now as a coordinator, but you can see from when Tina was talking about, there were a lot of people involved in the marketing and in the volunteer screening and getting them up to speed. There were a lot of people that helped make this program possible. And so we'll need to continue to have that moving forward. Also, as we move out of the pandemic, one of the things that we hope to see is more in-person volunteer experiences. As Tina talked about, one of the challenges is that they weren't able to sit down with the older adult to teach them how to use the tablets. And so we want to be able to improve that in-person experience. And then we also want to find new ways to recruit participants. And as part of that, we're looking to rebrand COVID Companions to where it doesn't feel so COVID specific, because companionship will remain important, but maybe we can make it more current as the time moves past the pandemic. Next slide. And so just reflecting on the achievements, we are so proud to be honored today, also as a second place winner in the Commonwealth Best Practices Award. And then in decreasing the social isolation and loneliness among older adults, I think is one of the primary outcomes that we're proud of with this program, and hope to continue to do that even as we move out of the pandemic. So thank you.
Finally, we will have Dr. Aileen McCarthy. After retiring from a long career in teaching and educational administration, Dr. Aileen McCarthy started as NVRC's executive director in August of 2019.
Thank you, everyone. We are honored also to have received the award for third place. We are the Northern Virginia Resource Center for Deaf and Hard of Hearing Persons, located in Fairfax, Virginia. And we started this program with input from the community. But first, I wanted to advance the slide to tell you a little bit about NVRC. Our mission is to empower deaf and hard of hearing individuals and their families through education, advocacy, and community involvement. We have a number of services here: information and referral, outreach and education, mentoring, email news, hearing screenings, ASL interpreting program, and an advocacy. We advocate for all manner of people who have hearing loss. Our website is listed there below. We also have a demonstration room shown on the next slide. people would like to come in and see the things that we have here for listening on the phone and being alerted, and to engage in telecommunication access. So we had that. We did not sell anything, but we refer people to resources where they can purchase or obtain these items at reduced or low cost or no cost. Next slide. So the Deaf Seniors Stay Connected program is connecting deaf senior citizens and ASL students online. The Deaf Seniors Stay Connected program provides a free online chat program to connect deaf seniors with American Sign Language students from local colleges, or students who are interested in becoming better at signing. And we've gotten students from several Middle Atlantic states to converse and engage weekly, but most of our students are from the Northern Virginia Community College system in the interpreter training program. Next slide, yes, this one. So we collaborated with the community on this before COVID. We were thinking about how we could engage with deaf seniors who are maybe moving out of their community, moving to a new state and becoming isolated and not really maintaining contacts with their deaf friends here in the Northern Virginia area. So a Happy Hands group, which is a group of deaf signing seniors, the Northern Virginia Association of the Deaf, Deaf Seniors of America, which is a national organization, and community college and 4-year interpreter training programs, and NVRC, we kind of came together. It began as an idea, and then it became a reality, thanks to the vision of NVAD and all of the groups mentioned here. So we thought we would start it out with visiting people in their homes and matching sign language students with seniors. But then COVID quickly had us think differently. So we kind of dropped that idea, and we started thinking about a weekly chat program where we had to pivot to how we would do this. So we hired a coordinator. She only works 6 hours a week. God bless her. I mean, she puts in a lot of work, but and we got a laptop for her. We got some money from the Happy Hands group, the NVAD group, and Pat Beach of the NVAD group and Happy Hands group helped us tremendously with publicizing the program. And we reached out to the ASL Interpreter Program Coordinator to advertise and recruit students. And Barbara, who was hired as the coordinator, she would research a topic, and every week there would be a topic. The important thing about it was that it was a facilitated conversation where they had small breakout rooms, and the deaf seniors and the ASL students could converse on a given topic and answer specific questions. We found that the program allows seniors, to chat with each other, but also with the students, and the ability for the students to see real live, I mean, not real live, but people conversing in a natural environment. If Zoom is natural, but now I guess Zoom is a natural environment. And so it was like a win-win for both groups because the interpreter students got to see, native speakers. Next slide. Okay, so I wanted to say the program goals were to include the deaf community. It was very important in all planning and advertising. Just as an FYI, I have 2 cochlear implants. I'm late deafened. But we also included groups, so we wouldn't be planning this by ourselves. We wanted to keep the seniors engaged, and we wanted also to reduce isolation and develop community. Yes, we believe that these goals were achieved and that people enjoy these weekly get-togethers quite a bit. Some issues that we had were internet connectivity. Sometimes the connection was slow. We had some inconsistent attendance, but not that much. And some early challenges were how to best view the participants. Next slide. So we had to look at how people would be spotlit and pinned and captioning. So this is a video of how we included the deaf seniors stay connected in the planning. The interpreter will have to voice this and should have captions, but apparently they're not showing up. Can we make the caption show up on the, okay, maybe make it a bit bigger. Okay. Can the interpreter voice?
This, we would like senior citizens to stay involved. It's an opportunity for senior citizens and ASL students from universities and colleges to meet and be able to interact using ASL. We connect through Zoom. You won't have to leave your home at all. Again, this is for senior citizens and students of ASL at colleges and universities to be able to socialize with one another through Zoom. You won't have to leave your home at all. There's no cost for this interaction. We are meeting on Mondays at 4:30 for about an hour.
I think we could stop there.
The program has 3 great.
Okay, so that was including the community in the planning, which was very important that people see that it's not just maybe an outside organization developing this program. It's us with people who are seniors themselves, advertising and recruiting. That makes it more desirable. And some participant comments, I pasted them here. It provides an opportunity to interact with deaf folks and to practice outside of the classroom, which is important. That's from a student. It's a good opportunity to meet different people who are interested in sign language and to share experiences. I value the time to use ASL in real conversations with deaf senior citizens. I learn from these chats as they describe hobbies, travels, community experience. I'm so grateful to learn and make new friends through the ASL chats. So the next slide is from the interpreter point of view, the student point of view, and we'll stop at the 1-minute mark. Again, this needs to be voiced.
I think that it's important to participate in DSSCP for the socialization. I've learned a lot from ASL, learning to read it better. I like this breakout groups. I appreciate that the topics that are selected are easy and to the point and convenient for conversations. I know if I sign something incorrectly, that the people there will give me feedback and help me sign it better, and that really helps my skills. I think it's important to learn ASL from the deaf senior citizens. I want to be able to learn from native signers, and the deaf senior citizens are really patient with us. And they help us learn their language.
Thank you. Next slide. So we were asked about possible applications for other groups. So we definitely can see that this kind of type of program would be useful for seniors, who speak a language other than English, with second generation youngsters who are losing the home language. We hear that a lot, like the parent or grandparent speaks a different language at home, and as the child grows up, they lose facility in that language. So we think that would be a good match. Also, nursing home residents with high school age language learners as part of their curriculum. For example, suppose we have someone who's in a nursing home who is a native Italian or Spanish speaker, and we maybe pair a 3rd year high school language student with that person to develop real useful language skills. We think if you were to replicate this, you have to include the native speakers in the planning. A coordinator, facilitator has to be hired to provide topics and facilitate discussions. Now, our coordinator only works maybe 10 hours a week. So it costs a lot more, but we have a lot of volunteers helping out. So I think you feel you must have a paid coordinator because it's a lot of moving parts. You need tech support for the virtual meetings. And that's where the Virginia Tech group talked about how they had to help. But our deaf seniors are pretty savvy with technology because they've used video phones probably a lot longer than any other age group, any other demographic. So I think we also think that there should be an incentive for students to attend. For example, there's the incentive of fluency, of course, but it can be a part of a course requirement, can account for community service hours, etc. We also think that you need to have small breakout rooms and time to practice. And it needs to be set for a certain regular time. So my time is coming to an end. But generally, the camera, you generally use for spoken language. It can be just audio, but we feel like it would be better if it was video as well. Assign a buddy. Make sure one person speaks at a time. Establish the length of the breakout room. The size 4 is good, and put the right people together. You get to know who is a good partner after you work with them for a while. Next slide. And so just basically that's, don't stand in front of a bright light. It's hard to see you. Next slide. This is where we think advertising should happen, senior centers, and similar to what the Virginia Tech group did in terms of reaching out to people, but maybe add immigration centers too. Next. Definitely is a mutual benefit for both groups, providing cultural, linguistic, and social understanding. We feel it's a mutually beneficial program. Next slide. And that's it. Thank you. Thank you very much. We appreciate being recognized. We're very pleased. Thank you.
Joining us today from Dominion Energy is Bill Murray, Senior Vice President of Corporate Affairs and Communications. Bill, would you like to share some thoughts on behalf of Dominion Energy?
Yes, ma'am. We're honored, as always, to sponsor these awards, which, as was mentioned, we've been doing since 2012. I just had one perspective to share from listening to the 3 award winners present. All of them, to a degree and to a large degree, are technology-based. While they were presenting, I happened to glance at the CMS website and the way we define instrumental activities of daily living, and we showed somebody on the CMS website writing a check and using a landline phone and carrying their groceries from the store. And as the book about COVID goes, that's maybe not how we live now. So I would simply challenge, given how ubiquitous technology is and how we live now, that we modernize the way we think about what an instrumental activity of daily living is. And well, I'm not trying to tout an Apple product, so let's make it technology agnostic. Whether it's an Android or an iPhone, the ability to use that might be as important as writing an old-fashioned check. And with that one thought that I had in mind from listening to the 3 technology-dependent presentations, thank you for all everybody is doing to work on this critical policy issue.
The follow question and answers.
All right, at this point, it doesn't look like we have any questions in our Q&A box, but I'll remind people, as I've put in the chat a couple times, if people have questions, they can either use the raise the hand icon at the bottom of the screen. They can click that and I will allow them to unmute or turn their camera on and ask the question, or they can type their question into the Q&A box and we can read it aloud. We'll go ahead and bring back all of our presenters and allow them to be there and answer any questions. And I think while we wait for some questions to come back in, if any of our presenters have any comments or thoughts that they want to share, and as they heard of other presenters go through their presentations, you know, I don't know, Charlotte, if you have any. Oh, we have one that came in. How do you all foresee the near future in terms of finances? Many are nonprofits. Do you see more money being given in donations? And I think any of you are welcome to answer that as presenters.
I think I can't see myself, but I don't know if I'm recognized.
Go ahead.
Okay, I would just say that this type of recognition will, I think, help us to get more funding, but I think that groups like the Dominion Energy group paying attention to the needs of seniors is just very important for us going forward. So the recognition itself is helpful, but I hope, you know, it's always a struggle to get more funding, always.
I was just going to add that I don't know about direct donations per se, but I do know that there have been different grant opportunities that have come down the pike and are in the near future that I believe that we can tap into to help keep this going for quite some time longer. And as was already mentioned by Eileen, we all know in any sector of what we do in a nonprofit, it is a challenge to keep anything going for any length of time. But fortunately with grants and, as she said, recognition and success in the programs, I do think we can keep it going indefinitely.
Great. We have another question for NV Rides. What were the FTA 5310 funds used for?
Yeah, hi, it's Emily. I can answer that. So our funding is not only through the FTA 5310, but our funding covers our ride scheduler software, our background checks, some of the marketing activities we do, my salary. It's a match between Fairfax County and the FTA, Jewish Council on Aging. There's a lot of funders.
All right, I'm just scrolling through the chat box too to make sure I haven't missed any that happen to come in through there. I don't see any. Don't see any. And if there's anybody, you don't necessarily have to use the raise the hand icon. If there's somebody that wants to be called on as well, you could just put your name in the chat box and I'm happy to call on you through the chat box as well. And allow you to unmute and turn your camera on and engage with us.
Martina, this is Charlotte. I wasn't sure if maybe want to read, I think Emily, you answered a question in the Q&A box earlier, and in case somebody hadn't seen it, maybe I'll just, somebody asked, are there any partners in Orange, Virginia? And Emily said there are not. We are only in 4 counties in Northern Virginia. I know Rappahannock has a similar program that includes gas cards, but it is administered differently. Looks like there's another question in the chat too.
All right, question for Emily. Are volunteer drivers required to provide their own driver's insurance?
Yes, not only for us, but in order to drive a vehicle in the state of Virginia, you have to have automobile insurance with specific limits. So we just ask for proof of it basically, but in order to drive, even if you're not a volunteer driver, you do have to have automobile insurance.
Great.
Martina, would you like Diana can share some wrap up?
The following programs also receive honorable mentions: Pop-Up Farmers Market, Arlington Agency on Aging, Caregiving at a Glance workshop and caregiving cohort, leveraging technology to combat isolation during a pandemic and beyond, regional transportation collaborative, senior ambassadors, Senior Services of Alexandria, Silent Isn't Golden, a public education awareness campaign about elder abuse, the Thelma Bland Watson Person Center PCI School, the Longevity Project for a Greater Richmond. We commend them for their excellent work as well. Thank you for attending today. The Council on Aging looks forward for the 2023 Best Practices Awards. More information will be forthcoming about the nomination process and timelines for that. Today's webinar will be available on the Virginia Governor's Conference on Aging website and on the Governor's Conference YouTube page. STARS will also make sure to post a link to the recording on the Council on Aging website. Thank you so much.
Thanks, Diana. And Martina, I think we had one last question that came in that maybe we have time for.
We did. A question again for Emily. Can you elaborate a bit about the cloud-based riding schedule software?
Yeah, it's called Ride Scheduler. If you Google it, it'll come up. It's a computer software. You pay for a license by the year, and then there's some training available. You can train your drivers and your transportation coordinators, and then they can use it in real time to select rides. It has Google Maps embedded in it as well, so people can get a good idea of where they're going and what the toll might be. So we've been using that with a lot of success since we started, and I know a lot of other programs across the country use it as well. I've talked to people in the West Coast, Northeast, everywhere. So it's pretty popular, but there's other options too.
And just as a reminder, again, as Diana mentioned, this webinar is being recorded. We will send a follow-up email to the webinar for everybody who not just participated, but everybody who registered, even if they weren't able to participate, with a link to the recording, as well as all the resources and contacts to our presenters as well. And so that way people have access to reach out to those presenters. And I will mention, in addition to these webinars that have been recorded, they are all posted. All of our previous webinars are posted on the Governor's Conference on Aging YouTube page. And if you are interested a bit more on that NV Rides program there, Emily did do a webinar for us. So there is a bit more information on the NV Rides program, and her recording is available on the YouTube page, which has a bit more extensive information. Emily, if you would like to share that one as well, so people could learn a little bit more about your program. So, and then I don't know if this is directed at everybody, but there is a question that came in just now as we wrap up. Does your organization have 501c3 tax status? And I believe each of you do.
Actually, the New River Valley Agency on Aging is a public nonprofit. We actually don't have the 501c3 status, but we still are able to get many of the grants that are directed to 501c3 agencies as well.
We are a 501c3.
So the Jewish Community Center is, and then our partners are, but most of them are, but you have to check with each one as to how their status works. Depends on who you volunteer for.
And COVID Companions was a university-based initiative along with what Tina was describing with her organization in the town of Blacksburg.
Great, thank you for that clarification. All right, well, thank you all for being with us today. Thank you, Charlotte, for leading this. Thank you to each of our presenters for taking the time for being here. having this many presenters often is difficult to coordinate all the schedules. So I really do appreciate each of you taking the time to be with us today, and each of our attendees for participating. So I really appreciate it. And we will see everyone next month. We look forward to being with everyone. And if anyone has anything they would like to hear about in this webinar series, please don't hesitate to reach out and let us know. So thank you so much.